Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. Want to welcome you to Wellness Wednesdays. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. I'm a family nurse practitioner who holds a Doctor of Nursing Practice degree. So that's where the doctor comes from. I'm not a medical doctor. I do have a doctorate degree. I'm a family nurse practitioner and love all things family nursing practice. Okay. So just to clarify that, I am the owner of Wells Legacy Health and Wellness. We are a full service primary care practice servicing all of your healthcare and primary care needs, health and wellness, you name it. This week, we are going to continue our discussion on the holidays and our health, or our health and the holidays. There's so many different things that can occur during the holidays, especially with the increased stress and the increase in demands of, the things that we have to do. And so it's so important that we take care of our health overall. Last week, we talked about holiday heart syndrome and depression and seasonal anxiety and things of that nature. So this week, we're going to delve into more of health and wellness when it comes to some of the things that are going on in our community. I don't know about you all, but I've experienced some, situations when it came to my health just recently. And I think I shared a little bit with you all last week. But I'm noticing an uptick, and typically we do around this time of the year. Anytime there's a increase in gathering and people getting together, we have the Friendsgiving, we have the Girls Giving, we have Thanksgiving, we have all of the homecomings events and the football events, the wrapping up of those seasons, different tournaments and things of that nature. And so the more you have people together, the increased chance of someone becoming sick or contracting some type of respiratory virus or illness is high. We see an increase in respiratory illnesses during this time, and just want to provide you with some updates on things that are happening in our community right now, as well as some things that we can do to prevent those. And if you do get sick, when is a good time for you to seek guidance from a healthcare provider? So we're going to jump into it. So as you know, we talk about all the things, and I love to stress eating well, getting rest, exercising, all of those things that help build up our immune system, that can prevent us from becoming sick or fortify or strengthen the immune system, so that if you were to come in contact with someone who is ill, then the chances of you getting sick, can be decreased to some degree. So during the colder months, as we talked about, we're usually, and then here in Florida, we don't really get that cold, but recently we've had some days where we were like in the 30s and the 40s, and I was like, this can't be Florida. But it was Florida. And so we know our weather it changes a lot, right? It's temperamental. And so one day it's hot, one day it's cold, one day it's raining, the next day it's windy, you name it, that's Florida. So during these times, respiratory illnesses like the flu, the common cold, and more severe infections such as the whooping cough, which is pertussis, and as well as what we're seeing now also is RSV, which is respiratory syncytial virus. And as we talked about before, RSV used to only be seen in little babies and kids, but now it's being seen in older individuals, and it's being seen across the board when it comes to any individual. So anyone is at risk for RSV. And then, of course, COVID is still on the scene. We're still seeing COVID. COVID hasn't gone anywhere. It's still here. People are still testing positive for COVID. We have flu A and B. There's all the things. It's like a smorgasbord of different respiratory viruses and illnesses that are being seen in our community right now. And so what do we do? What do we do to prevent the spread of these illnesses? They can spread easily. It's just a matter of someone coughing and not washing their hands and touching the surface, and then someone else coming behind them and touching that surface, and then that person touching a door to go into a store, and then that person touching the keypad, someone else coming behind them and, touching the door and then wiping their face. It spreads just that easy. I can remember when I was in my nursing LPN, I believe, LPN or RN, I think it was my RN program, where we had to go out into the community and provide education. And so we did education to an elementary school, and it was, I can remember like it was yesterday. It was Catalina Elementary. I went to Catalina, my aunts went to Catalina, my brothers went to Catalina, my son went to Catalina Elementary School. And so I chose to go back there because it was familiar and it was home. And I did an exercise with them with the glow light. So I had some powder. I taught them hand hygiene, how you wash your hands. We sang the ABC song, but then I had the glow powder that I put on my hand, and I put on certain individuals' hands throughout the class without anyone else knowing. And we began to just play and interact with one another. When I turned on the glow light, you'll be amazed at how quickly those germs, the powder, spread. It's so important that we are practicing hand hygiene, and we'll kind of talk about that a little bit. But I do want to bring up whooping cough. This is not one that we hear much about. It's pertussis, and this is a part of the vaccination that we get, right? When we're children, we usually get the whooping cough or the pertussis vaccine, but we're seeing a insurgence of it because we have a lot of individuals who choose to forego vaccinations, non-vaxxers, or people who don't believe in it. And to each his own. I don't push either one. As a health and wellness practitioner, I'm for the patient on what their needs and desires are. Of course, I'm going to provide education on all things, right? Give options. And that's what it's all about, making sure that we have options. So when it comes to whooping cough, or whooping cough, as some people call it, pertussis. Pertussis is a highly contagious bacterial infection that causes severe coughing. So it's coughing nonstop that will not stop. And the hallmark is a whooping sound. It's produced when someone tries to take in breath after coughing, after they have a coughing fit. Infants and young children are especially vulnerable to this illness. Some can be more severe and can lead to pneumonia or even seizures, depending on if there's an elevated fever, elevated body temperature, things of that nature. And if it's not clearing up in, a quick amount of time, it can turn to a bacterial infection. Well, it can turn into pneumonia is what I wanted to say. The symptoms is a persistent coughing, difficulty breathing, and a whooping sound when they're inhaling, like, and it's because they're trying to catch their breath, and their bronchioles and their lungs are irritated, and it just creates this really specific sound. And so that's how we typically will diagnose whooping cough. How do we prevent it? We want to make sure that our family and friends are up to date on their vaccinations. And if they're not, then we want to make sure that we are taking precautions to keep those kids and those children from other individuals, especially if they're sick. So the Tdap vaccination helps protect us against whooping cough and the tetanus and diphtheria. So it's the DTaP, which is the whooping cough, tetanus, and diphtheria. They're all included in that one vaccine. And so that's the vaccine that will help prevent whooping cough or pertussis. The next thing we have is flu. We all know the flu is very common. We see it a lot. We're seeing an increase in flu now. And there's two strands. There's flu A, flu B. And there's also the flu vaccine. So again, there's vaccines for majority of these things. It just depends on you as an individual, whether or not you want to become vaccinated against it. So what we know about the flu is a common viral infection. And while most people recover with rest and fluids, just kind of taking some time to rest and getting plenty of fluids, some individuals, it can lead to more serious illness or hospitalization. And we've actually seen death occur from the flu. Those individuals who are younger, who don't have really strong immune systems, babies, children, those who have, comorbid conditions, maybe they have diabetes, they have some other situation going on with their immune system, or disease processes that cause their immune system to be weakened. Those individuals at a higher risk for severe illness, hospitalization, and also death from the flu, from the common flu. It's hard to believe, but it does happen. So young children, older adults, and people with chronic conditions, as I mentioned, are at higher risk for developing more severe complications from the flu. So what are the symptoms? You have fever, you have cough, body aches, and fatigue, right? How do we prevent the flu? One, of course, you can get the flu shot. And I've heard it many times. I got the flu from the flu shot. That's not the case. Either you've already been exposed to the flu, or you didn't get it from the flu shot, because it's not a live virus. And so I got the flu shot once and I got sick. And as a healthcare provider, I thought the same. I was like, how in the world? I just got this flu shot this morning. And by the end of the day, I was sick. Well, I probably had already come into contact with someone, and just getting the vaccine just kind of triggered something in my immune system. I don't know, but we can't get the flu from the flu shot. Can you get a little achy? Yes, because it's just your immune system working to, integrate this vaccination in your system. So how do we prevent it? One, get the flu shot. And then the most effective way is to protect yourself from the flu vaccine is vaccine. And then, of course, staying home if you're sick, washing your hands frequently, making sure you're getting rest, eating properly, exercising, all the things, right? And then we also have the common cold. This is a viral infection. It's less severe than the flu, but it can be a problem, right? It comes with all the things: the runny nose, the sore throat, sneezing, coughing, and mild fever. The way you can differentiate between fever, the flu, and a common cold is with the flu, we tend to see higher fevers and they tend to last longer. Common with the flu, some individuals may also have runny nose. So the only way to differentiate between a common cold and the flu is to get tested. And typically we'll have you go in and we'll do a swab, check you, see if you have flu A or flu B. Treatment, is there going to be much different? Depending on your symptoms. We're going to treat you and the symptoms that you have. Again, ways to prevent and to keep yourself from getting sick with the common cold: one, staying hydrated, making sure you're washing your hands frequently, avoiding close contact with individuals who are sick. Some of the key takeaways that I want to leave you with when it comes to this is that we want to be mindful of our health, and you want to be mindful of the health of others, and then also be mindful of your hygiene. Making sure if you're sick, you're coughing, not coughing in your hands, you're using tissue, you're sneezing in the folds of your arms, things of that nature. Those are going to be things that we can do to prevent those germs from being spread, right? I think it is, if someone sneezes, it could launch about 7 to 8 feet away, those particles, and they spread out. I remember there was a demonstration on how forceful a sneeze can be and how far away the respiratory particles can go. And it was just amazing how far away they can go. And then many viruses will last on solid surfaces for a period of time. So if those areas aren't cleaned well, then that virus could still be there. One of the things, I know there's a lot of travel during the holiday seasons. We're on the airplanes, we're using public transportation. People are going away, they're taking trips, they're using the subway and the different things, the hop off buses. Make sure you're carrying your sanitizer with you, because if you don't have the ability to wash your hands, sanitizer is going to be the next best thing. I am notorious for, when I'm traveling, I have my little kit. I bring my gloves, I have my mask. Yes, I still wear a mask. I have my Lysol, and I have sanitizer and Clorox wipes. When I'm on a plane, before I get settled, I put my things away. I put those gloves on as soon as I sit down, or even before I sit down, if the plane is not that busy, and I begin wiping things down. I don't necessarily spray the Lysol spray on the plane. If I have my wipes, my Clorox and my Lysol wipes, I will wipe down all of the surface, the seat, the window, the chair in front of me, the tray, all of that. I wipe it down, and then I put the, used wipes inside of the gloves. When they come by, I quickly discard it. Then I sanitize my hand, put my mask on, and I'm good to go. So we need to make sure that we're practicing those things to keep ourselves safe. When it comes to health and hygiene, and I'm sorry, my dogs are barking in the background, so if you can hear them, I apologize. Good hygiene practices are so important to staying healthy during the holiday season, and not just the holiday season, but year round. Hand washing is the most effective way to prevent the spread of germs. You want to make sure that you're washing your hands thoroughly with soap and water for at least 20 seconds. And what I say is, sing the ABC song. Sing it at least twice. right? A, B, C, D, E, F, G, H, I, J, K, L, M, N, Q, R, S, all the way through, right? You're going to sing ABC at least twice. That gives you enough time to get the good lather and rinse your hands well. You're going to grab that paper towel and dry your hands. So at least 20 seconds longer if possible, especially after coughing or sneezing or touching surfaces in public. Now, this is where the sanitizer comes in. If water and soap is not available right then after you walk into a store, then you've touched that door. How many people have come in front of you and touched that door handle to open up the door? That's why I love the automatic doors. I don't have to touch anything. So that's where the sanitizer comes in. And you want to make sure that it has at least 60% alcohol. Covering your cough. We want to teach, especially the kids. I see so many kids coughing. They don't cover their hands. They're sneezing. They're not covering their hands. Or they're sneezing, do this, and then they're touching stuff. So let's just make sure that we're educating our kids and the little ones, even some adults. We got to educate some adults. Sad, but it's true. So you want to wipe down high touch areas. So disinfect those things. Let me go back. Covering your cough. So teaching your family and friends, especially children, to cover their mouth and nose with a tissue or the inside of their elbow when they cough or sneeze to prevent the spread of respiratory droplets. Disinfecting common surfaces. As I mentioned, I'm a stickler for my Clorox and Lysol wipes. And I'm going to clean down. If I'm going somewhere and I'm sitting, I'm cleaning it down. I've kind of gotten away from it when I go to the restaurant because I just assume that they're going to clean the tables for me, but I need to do that as well. I also dip my silverware. If I don't get plastic utensils, dip my silverware in hot water. Just weird. But anyway, you want to make sure you're wiping down frequently used surfaces. So if you work from home, it's just you typically in your workstation, but make sure you're keeping that safe, that clean. And if there's multiple people using that area, if you work in an office and you are going to commonly used places, make sure you're wiping down, those areas as well. And then in public spaces as well, think about doorknobs, light switches, countertops, using disinfectant wipes. And I love Lysol and Clorox wipes. Those help decrease the transmission of viruses and bacteria. Wear a mask when necessary. If you're going to be in a crowded place, I still see a few people wearing masks, not as many, but I always keep a supply of masks on hand, especially when I'm in a really crowded place or if I'm traveling, I will bring my mask and wear my mask. And especially if you're feeling under the weather. And just know that the mask helps both you and others, right? So if you're sick and you have to go out, you're going to a doctor's appointment, wear a mask. If you're sick, try and stay home. So supporting your immune system, nutrition, sleep, stress management, we're going to talk about that. So nutrition, we already know. I talk about a balanced diet, rich in vitamins, minerals that are going to support your immune system. So those foods that are high in vitamin C, the oranges, strawberries, bell peppers, if you don't have any allergies. Vitamin D, the fatty fish, fortified dairy products. If you can't do dairy, then look at some other alternatives when it comes to vitamin D. There are vitamin D supplements. You can get the vitamin D injection. And the best place to get the vitamin D from is the sun, even though many of us don't get enough vitamin D from the sun, especially our more melanated individuals. But just make sure that you're getting vitamin D in. And these are so essential and special during the cold and flu season. And don't forget to stay hydrated. My Gatorade. Make sure you're staying hydrated. Water, herbal teas, broth will also help you to maintain hydration. Some individuals love bone broth, especially when they're not feeling well, because it has all those vitamins and nutrients in that bone broth that will help. There's also some vegetarian broth that you can get that has the nutrients and vitamins from all the good veggies that we need, right? So staying hydrated will overall promote wellness and keep you, in a place where your nutrition is well balanced, right? So all the right foods, all the minerals, and the water. Sleeping, right? We already talked about this. Holidays can be a busy time. We're busy shopping, we're working, we're preparing for our trips, we're getting ready to do all the things, attending the events, attending the parties, the holiday dinners, Christmas gatherings, and before you know it, it's 12 o'clock and you still haven't gone to sleep yet, but yet you got to get up at 6 in the morning. And so it's recommended that we get 7 to 9 hours of quality sleep per night. Lack of sleep, sleep that is not well balanced, meaning you're not in that REM stage as long as you should be. You're tossing and turning, you're getting up frequently, you're waking up frequently, you're not getting proper rest. And so that does put your immune system at risk for developing illnesses. It makes you more susceptible to illnesses. Stress management. We talked about this last week when it comes to holiday heart. Stress management is so important, especially with traveling, family gatherings, gift shopping, things of that nature. Chronic stress weakens your immune system. It increases the cortisol levels and it just wreaks havoc on your body. So practice things that you know help for you. Some of the things are deep breathing, again, yoga, meditation, taking a walk, exercising, journaling, reading, praying, whatever it is that you do to kind of help you with stress. Put all those things at work this season, okay, to make sure that you're not putting yourself at risk for getting sick because of stress. Managing health in a family. So special focus on the kids and the elderly. We kind of talked about that. The kids and the elderly, our children, our babies and the elderly are at such a higher risk for developing these conditions that we talked about, being infected by flu and respiratory, RSV and whooping cough and COVID and all of those things. And so while we want to gather with our family, let's take into consideration those who are more vulnerable, right? So when we're preparing to go to the family outings and the family gatherings, let's do our part to make sure that we're not sick and bringing it into them. Vaccination is key. You want to make sure that we're keeping out for the signs of any respiratory distress for our children, like wheezing and trouble breathing. And if they develop a persistent cough or other flu-like symptoms, you want to make sure you take them in and get them checked. Same holds true for older adults. They're at higher risk, as I mentioned as well. And we want to make sure that our elderly family members, our elders, are taking care of themselves. If they're ones who get vaccinations, make sure they're getting vaccinated for the flu each year. Make sure they're avoiding the crowded areas. Maybe we need to cut back on the amount of people that come to the family gathering. So I know COVID days, we did a lot of virtual things. So maybe we look at doing some alternative gatherings this year, especially if we want to make sure that our elderly individuals, our elders, are not getting sick. And if we are going to have a family gathering, let's do our part to make sure that they are taken care of, okay? Make sure they're staying hydrated, make sure they're eating well, make sure that they're getting enough rest. And overall, I want to just highlight that even though I'm talking about these things, I don't want it to be a damper on your holiday, right? Christmas, we just had Thanksgiving, New Year's is coming. These are all time to spread joy, to enjoy our family members, to catch up, to make memories, to bake the cookies and all of the things, right? And so it's time to celebrate. So I don't want this to be a damper, but I do want the things that we talk about to be in the background of your mind, right? So as you're shopping and as you're gathering and you're getting together with your family, keep those things in mind. When it comes to food preparation, make sure that the food is prepared properly and that it's stored properly. So if you have your dinner is at 6 o'clock, we can't allow the macaroni and cheese and all the food to sit out from the morning, right? So just being wise when it comes to that. Also, have sanitizer on hand for any of my events that I have at my house, and I love to host. For any of my events, I make sure we have hand sanitizer in multiple places, right? There's soap and water. You know, of course, they have access to water, but the hand soaps and things like that are readily available. And sanitizer is right at the front of the buffet line. So making sure that people are washing their hands, that they're using the sanitizer. And if they're sick, hey, if you're sick, please don't come. For Thanksgiving, my mom and everyone in her house was sick. And so we were all supposed to go to her house, but we forego going over there because we did not want others to become sick. And I would hate to have someone come to one of my gatherings and get sick and end up in the hospital. So we want to make sure that while we're enjoying each other, health is a lifelong commitment. Being healthy is a lifelong commitment. It's not just a seasonal thing. It's not just a one-time thing. It's a lifelong commitment. The holidays are just a part of the year where we need to pay that extra attention. But staying healthy, staying safe, and enjoying the hospital during the holidays to the fullest takes everyone's involvement. So it takes all of us as a team, as a family, to make sure that we're all staying healthy. So as we prepare for Christmas, for whatever holiday you celebrate, whether if you don't celebrate Christmas, whatever you celebrate, Hanukkah, there's many different holidays that are being celebrated around this time of year. I personally celebrate Christmas, and we will be gathering with family on that time, and I'm sure many of you as well. And so just be safe and take care of yourselves. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. I hope something that I've said tonight is helpful for you, some nuggets that you can take back and implement during your holiday gatherings with your family, your Christmas outings and gatherings with your families. And just stay safe and be well. We are Wells Legacy Health and Wellness. Again, a full service primary care health and wellness practice. We're located at 542 Osceola Street, Altamont Springs, Florida. You can reach us at 321-306-6755. You can schedule an appointment with us online, or if you don't see an appointment available online, of course, you can always give us a call. Stay safe and be well. Until next time, we'll talk to you later. Bye.